Low-intensity shockwave therapy, LISWT, is a non-invasive therapy that's been used in orthopedics for years to help heal broken bones, injured ligaments, and injured tendons. Shockwave therapy has also been used to improve wound healing.
So shockwave therapy is really one of the biggest topics that's out there right now for erectile dysfunction. It's impossible to go a day without seeing an advertisement for shockwave therapy somewhere, whether radio or TV or billboards or whatever. But it's really important with shockwave therapy to differentiate between what's called pulse wave therapy and true shockwave therapy. Pulse wave is a different type of energy, and that tends to be one that's advertised pretty heavily. There's only one randomized controlled trial currently available on pulse wave therapy, and that one showed no benefits at all. Shockwave likely does have limited benefits. There are many what are called meta-analyses that look at multiple studies combined together, and they show that there's probably about a 2 to 4 point difference on a scale called the IIEF. It's our way of measuring improvements in erectile function. And basically that type of improvement is going to be less than what you see with exercise. It's going to be less than what you see with Viagra, Levitra, Cialis, or things. So it probably does improve erectile function a little bit, but it's probably not nearly as much as is demonstrated in some of those advertisements. We also don't know if it works long term. And so there's more studies that need to be done, and especially long-term studies, to really demonstrate if it's a worthwhile therapy.
Using targeted high-energy sound waves, shockwave can promote neoangiogenesis and speed up tissue repair. Erections rely on healthy blood flow to the penile tissue. Shockwave therapy is viewed favorably as a way of repairing and strengthening blood vessels in the penis and improving blood flow. Numerous clinical trials and meta-analyses demonstrated the safety and efficacy of shockwave, and therefore European Association of Urology guidelines recommend its use in selected patients. I personally believe that it can be a reasonable drug-free option for patients who suffer from mild erectile dysfunction.
Germany was very conservative towards shockwave treatment of Peyronie's disease and erectile dysfunction, but now we have a new EAU, European guidelines, and also guidelines of the European Society of Sexual Medicine that describes that there is an evidence on shockwave, and you can use this method of treatment in various of patients.